Welcome to the LMS Bootcamp for the newly diagnosed and those who love you. Like the rest of us, you've been drafted into this combat zone to fight for your life. Bootcamp will give you the basics to help you survive. Bootcamp is tough. You'll need to keep your cool and use your wits to strategize and outsmart the enemy. You'll need to learn a new language of medical terms, find facts, and build skills. Most important, you need to team up with others. Like any other boot camp training, it's not always pleasant, but this is for your survival. I'm Sharon Anderson. In January 2002, I too was diagnosed with uterine leiomyosarcoma. I wanted a map to find my way. There were much less options back then. I felt stunned, I felt lost, powerless. Thanks to a few others I found online, I changed. To be honest, I needed a good kick in the pants to get me started. I learned to research and then make informed decisions. I used my angst to advocate for more treatments for us all. I'm also the executive director of LMSDR, or LMS Sarcoma Direct Research Foundation. It's been my therapy and my hope. We've been a nonprofit since 2006. We've raised over $1 million for LMS-specific research, collected over 500 patient tissue blocks, and created a tissue bank in 2005, collected personal LMS history to go with each block. We've established a patient registry. We've put on 4 LMS conferences in Denver, San Francisco, New York City, and Hawaii. We've advocated for more LMS research at CTOS, which is the Sarcoma Research Conference. We've collaborated with other sarcoma and rare cancer foundations. We started a Facebook group with online information and support that's confidential. And last, we put out the LMS e-alerts newsletter. Okay, before we get started, a small disclaimer is necessary. LMSDR does not give out individual treatment advice, but offers the following resources for your own pursuit of investigation. Please discuss the suggestions made here with your doctor. We highly recommend you join the LMS Facebook group, where you'll find over 2,000 LMS survivors and loved ones, offering valuable information and support. We list the resources at the end of each webinar. Last, I want to share LMSDR's slogan. My dear friend and founder of LMSDR, Suzanne Kurtz, told me, if you really want something, you have to work for it, not wish for it. We hope you roll up your sleeves and help us in our mission. Newly diagnosed, hearing those 3 words, you have cancer, is traumatizing. Many of us have post-traumatic stress disorder, where we live in constant fear and anxiety. This is normal, your new normal. You will learn to cope better with education and support. Don't hesitate to help yourself with therapy. I've written an entire webinar, number 6, on coping. It's also on the website under support. If you need to start there, do. Then come back again to webinar 1. So humor is one of my coping skills. It says, it's very rare. We don't even have a colored ribbon for it yet. You know, the funny thing is, I was actually around when we came up with the color on our online support group. It's purple. Okay, so what is leiomyosarcoma? It's a cancer of the smooth involuntary muscles. Those are the muscles that you don't really think about how to move. They move on their own. So how rare am I? So sarcomas, they're cancers of the connective tissues in your body. They're only 1% of all cancers. And there's about 70 types of sarcomas. There's 2 categories of sarcomas, soft tissue and bone sarcomas. So LMS is one of the more common soft tissue sarcomas. It's estimated to be 10 people in a million, and about 3,000 LMS patients in America in a year. So there are 3 main subtypes of LMS that most people have, although this isn't exclusive. One is uterine, where it starts in the uterus. The other one is retroperitoneal. That's the abdominal cavity that holds your digestive organs and kidney, bladder, uterus. And the last one is vascular. So those could be the small veins and arteries and capillaries. On a molecular level, rather than the location of the tumor, these can be very different and respond to different chemotherapies. For a simple example, very simple, uterus LMS can be grouped into those with hormone receptors on them and those that don't. One of the most important things that everybody will tell you on the online support groups is see a sarcoma specialist. We have research that actually shows patients who are seen at major sarcoma centers live longer. So what's a sarcoma center? This is the criteria to be considered a sarcoma center. There's a team of sarcoma experienced oncologists, surgeons, interventional radiologists, and pathologists. This team holds case conferences, also known as tumor boards. They see at least 100 sarcoma patients a year. They attend CTOS, the Connected Tissue Oncology Society conference, annually. They publish research on sarcomas, and they offer sarcoma clinical trials. So how do you find a sarcoma center? You can go on our website, lmsdr.org, look under support, and then we have a listing of sarcoma centers. We also have a listing of other websites with sarcoma centers like Sarcoma Alliance. What you need to know. So here are the 3 biggies. Keep these in mind when you make your treatment plans. Okay, number 1, LMS is chemo and radiation resistant. Surgery is our most effective treatment. So take a look at the rates, the effectiveness rates that I've listed below. Folks, those are not big numbers, and you need to remember this when you're making your treatment plan. The decision to use adjuvant chemo is a hard one, and it's yours to make. Using chemo when you don't have any known tumors is controversial. To date, there's no known chemo used adjuvantly that affects long-term survival in LMS. Most sarcoma experts recommend using a chemo only when there is a tumor they can measure. The risk of metastasis is very high with LMS. At stage 1, 50 to 70% of people will get a recurrence, and that's mostly to the lungs. Metastasis is most likely to start within the first 2 years, but you are always at risk, even 5 to 18 years after you've been diagnosed. Surveillance has to be aggressive. CT scans every 90 days until 2 years of being tumor-free, then 6-month scans for 2 years, and annual scans long-term. So how long do I got, Doc? Research does show that stage and size of the tumor are factors. But let me tell you, there is no crystal ball, and no doctor can tell you how long you've got. First off, the statistics are very old, and we've seen several new treatments approved in the last few years. We have many long-term survivors, and we actually interview one in each LMS eAlerts newsletter. What my doctor told me, I'm going to tell you. Stay alive until we get treatments that cure. How do you become a long-term thriver? 3 things: educate, advocate, and collaborate. Educate, read, publish research on PubMed. Find clinical trials. Subscribe to the LMS eAlerts newsletter because we have a lot of news published there about trials and the latest research results. Use LMSDR's website and webinars and attend LMS conferences. Advocate. Know what you want and be the squeaky wheel. Always have a plan B. Get second, even third opinions at sarcoma centers. Consult surgeons and interventional radiologists, not just the oncologists. Contact drug companies to get compassionate use of the drugs you want. Collaborate. Ask your local oncologist to collaborate with the sarcoma specialist, then you can get your treatments at home. Get a sarcoma team, oncologist, surgeon, interventional radiologist, and a social worker. Join and network with over 2,000 LMS patients and loved ones in the LMSDR Facebook group. Okay, let's summarize. Leiomyosarcoma is a rare cancer of the smooth and voluntary muscles. Sarcomas are only 1% of all cancers, and LMS is one of the more common ones. Common subtypes are uterine, retroperitoneal, and vascular. However, everyone's type is unique to their own cancer cells mutations. It's important to know that LMS is chemo and radiation resistant. Surgery is our most effective treatment. Adjuvant chemo has not been proven to affect long-term survival. Risk of metastasis is high. Surveillance should be aggressive and long-term. Patients who see a sarcoma specialist survive longer. Prognosis is improving every year due to new treatments. A cancer diagnosis causes shock and trauma, and you need to see the coping skills webinar. To be a long-term thriver, you must educate, meaning research, advocate, speak up, and collaborate. Get support.